Hello. It's been quite some time since we've had an opportunity to sit down and have a conversation with you again about what's been happening at Wellspring over these many weeks now and months of the COVID pandemic. We had started, you may recall, what we were considering our Friday updates via Facebook way back in March, and had continued that all the way up into June. And then tapered off because conditions had changed significantly, and so felt like that was the right approach to take. Now we know conditions are changing again. There's new rules, there's new situations that we're responding to at Wellspring, and so we wanted to reopen this dialogue, really intended to talk to our staff, our families, certainly our residents, and many other folks who just care about what's going on at Wellspring. So we invite you to join us for these. Sean DeFore, our Chief Operating Officer, is with me again, and he'll provide some updates here in just a moment. But I don't want to start without saying how grateful we are for just the incredible work of our staff over these many months now. The intensity of the spring gave way to a little bit of a respite through the summer. And now we're ramping that intensity back up again. And our staff has just been incredibly professional and dedicated and caring and loving each other and our residents. And we're so grateful for that. So Sean, if you would, maybe give us an update on where we're at now in terms of our readiness and our sort of our posture at this point.
Yeah, the best way to describe it, Dave, is we're in a much better place than we were in the spring when we started to see a spike. Back then, getting a hold of personal protective equipment, PPE, was very challenging. Availability was very limited, and we were doing our best to find it everywhere we could. We spent much of the summer stockpiling what we could, and we're seeing the pipeline and availability of PPE really opening up. So we're pretty well stocked and well supplied, and our staff are using it every day and constantly in our facility to keep our residents safe. The real game changer this fall and winter, Dave, has been testing. And back in the spring, most people saw the testing was not very widely available. It's very limited. And now we actually have, weekly or twice weekly testing we're doing with all of our staff, many of our residents, and we have instant point of care testing that allows us to do a test within 5 to 15 minutes and get a result. And what that's done is just completely changed our ability to identify the virus getting in and control it so it doesn't spread, which has been fantastic.
Yeah, that's right, Sean. And, we think about what we were dealing with in the spring, really, and we talked about this, right? Fighting what we called the invisible enemy back then, not knowing really anything about where it would go next, and until we saw symptoms. And you're right, the testing availability and frankly the protocols you and your teams have put in place, and the use of that testing has been incredibly helpful to where we're at now. So when we think about where we're at now on a larger scale, from a community spread standpoint, from just sort of where the pandemic is at, we know that cases are rising really across the nation, across the world. And this second surge that was predicted is indeed upon us. What's a little bit different at this point, as we observe this and track it, is that in the spring, the outbreaks, if you will, were generally in sort of institutions and congregate care settings. Nursing homes certainly got hit hard, assisted living facilities, other congregate settings was where the concentration of many of the cases were. And there was some out in the community, but that has sort of changed now. And what we're seeing is significant spread in the community, and our congregate settings in a much better posture, as we just talked about. And so the battle has changed in terms of the field of the battle out into our communities, which we can talk about a little bit in terms of what we need to do about that. But internally, Sean, give us an update on what does it mean to us right now? What are we seeing in cases within our buildings and so forth?
Yeah, and I think the way you described it, Dave, was pretty appropriate and accurate. Unfortunately, we are not immune, and we're seeing the same sort of trend that the rest of the country, the state, and other facilities are seeing, and that is that numbers are increasing across the board. And unfortunately, what we have seen is at this point, every one of our facilities has had at least one case, either a staff or resident or both. We were able to make it through the spring and much of the summer with the majority of our facilities never seeing a COVID infection at all. So it is finding its way in. What's different now, and what we're really grateful for, is that the cases are isolated, limited, and not spreading. And I think what that tells us is that the testing, the PPE, the protocols that we have in place, our infection control procedures are holding and preventing any threat. So at this point, we've not had a facility that's had more than 2 or 3 cases, either staff or residents, and we just haven't seen it spread beyond that. We are seeing cases in some of our staff popping up, our community-based staff in foster care, in our family preservation programs. But again, because of the protocols, the testing, we have not seen that spread to any of our clients or to other staff. So the cases are remaining pretty isolated, which we're grateful for.
That's great, and obviously, vigilance going forward is the name of the game. So I want to touch back on this issue of the community spread that we're seeing, and what's interesting is that death rates and hospitalization rates are actually down over the spring. And what I mean by that is the percentage of people who get COVID and end up in the hospital or end up dying, that percentage has dropped. However, because the numbers are getting so big in terms of who has it, the number of people who have it, that those hospitalizations and those deaths are growing again. And so we know that in many parts of the state, hospitals are being overwhelmed, and nursing homes are being asked by the state to consider how best we can serve and help with the public health crisis. So we're working with the department on that. We're looking at our own systems and what we and others might be able to do to help mitigate that. So we've got our eye firmly on the current situation. As Sean said, we feel like the testing and the supplies are a game changer, and we're starting to look ahead. And we don't have time to sort of get into all the things that will be coming down the pike here. But we do know that vaccines are starting to arrive in terms of the delivery of those supplies. They'll ramp up in terms of quantity over the next several months. And so we're working on that. We're thinking ahead to what the holidays are going to be like, and then into the post-holiday winter. And so we're going to be standing up these Friday updates until further notice, and opening up other lines of communication for you as you might have questions going forward. And so just as always, we just thank you for your support and encouragement. We always request and covet your prayers for Wellspring, and particularly for our people who are out doing incredibly important work right now. Everything from our Child and Family Services Division to our senior services and our growing behavioral health programs. The people of Wellspring are really stepping up. And so we encourage you to keep us in your prayers, and we'll look forward to chatting with you on future Fridays. Thank you.